Hi, everybody. Welcome back to the Resilient Aging Unfiltered podcast. Today, we have a great guest who I met recently, and I'm so excited about what kind of fun collaborations are going to happen. But here we have Parker Condit. So let me tell you about Parker. He is the founder and director of InTouch Health and Performance, a Phoenix-based practice dedicated to helping older adults thrive as they age. With more than 10 years of experience in personal training and healthcare, Parker empowers clients to maintain strength, independence, and cognitive ability through tailored exercise and lifestyle programs. He holds specialized training in working with aging populations, including certification from the Alzheimer's Association. And in addition to this work, he also facilitates a men's group called Men of Compassionate Action. Now, beyond the gym, Parker is passionate about educating communities about lifestyle factors like movement, breathwork, nutrition, sleep, and social connection, and how these can directly shape our lifespan and resilience. And he has lots of hobbies, including cycling, spending time with his wife, and enjoying life with their two dogs, Mac and Lewis. Thank you for being here today, Parker.
Thank you so much for having me. And it's Lewis when he's in trouble, Louie the rest of the time.
Cute. What kind of dogs are they?
Max is a big mix. He's like a Ridgeback Houndy mix, about 90 pounds. And Louie is a Cavachon, so a Cavalier King Charles Bichon mix.
Wow. They sound cool.
Big dog, little dog.
Okay, fun. Well, I have lots of questions for you. I'd like to start with, well, as you know, I'm an Alzheimer's specialist physician and love working with older adults. And throughout my work, I have often been seeking someone like you who is a personal trainer who enjoys working with older adults specifically and has that passion. And so excited that we connected. Maybe you can share, what led you or what makes you excited about this work you do?
So my story kind of begins back in Colorado when I was a bit of a naive 20-some-year-old and I just became a personal trainer. My first full-time job as a trainer was in a very interesting integrated facility where there was a gym, there was primary care, there was chiropractors, there was health coaches, there was mental health professionals, there was a lab downstairs, there was cardiac rehab. Across the parking lot was a physical therapy office where anything that was outside of my scope, I would just walk them down the hallway. It was like the perfect model of holistic and integrative care. And I was 24, 25 at the time. So I was thinking, oh, healthcare is amazing in America. Look at this model of integrated, coordinated care. It's beautiful and it works so well. And as you know, when things are integrated like that, they do work extremely well. So I spent 2 years there, and then I moved down to Phoenix, where we are now, and I found out it was kind of like a rude but necessary awakening to the realities of the U.S. healthcare system, where I understood, it actually doesn't work like that at all, where it's very disconnected, even within the medical community. It's like, even within the medical side of things, they don't necessarily coordinate extremely well. It's very hard with communication, with HIPAA, with EHR records. So then my next sort of transition as a personal trainer was working with one of my clients who was an investor. He wanted to start a company around kind of data management, patient data management. So we did that together for a few years, which again was just aggregating data, patient data from various sources, giving the patients the control of that data, and they could invite in their caregivers, they could invite in different healthcare professionals they were working with. So you're probably starting to see a theme of coordination around patient care across the medical and wellness worlds. That company we did for about 4.5 years. It never really turned into exactly what any of us wanted to, but a great experience, got me exposed to working with senior populations, aging populations, working within Medicare. So then outside of that, I went back to, or beyond that, I got back to personal training, and I knew my next step was going to be working with the senior population, which is kind of where we are now. So working with seniors and understanding that there is a big gap in a lot of the care between all of the resources are there. They're just not well coordinated. And it's a lot of work on either the caregiver or on the patient themselves, where they have to decide who to work with. And then also the burden of communicating what their physical therapist said and communicating that to me, or what their nutritionist said and communicating that to me. And they don't necessarily have that knowledge and that background to adequately be that middleman of communication. So my company works to kind of work along the wellness side of things, where I work with health coaches, I work with dietitians, I work with other trainers physical therapists, where I help coordinate a lot of that care, and then working with great medical professionals like you as well, just so the patient or the client has less of a burden to kind of manage all of that coordination on their own.
Okay, great. Thank you for explaining that trajectory. I think I still want to hear, you said it was sort of like I knew the next thing was going to be working with older adults or seniors. And not everybody, that to me, that wasn't like necessarily what would happen next, given your story. So, yeah, what is it that you like about this, or what draws you to it? Or is it just like you fell into this and there's a need?
I think there's two sides of it. One is that I've seen that seniors, from a societal and like cultural standpoint, they're a little bit discarded. And that's kind of a byproduct of like living in a capitalistic culture, where it's like when you can no longer provide for capital, it's no longer like as valued by society. So a lot of seniors do deal with the feeling of being kind of like discarded. So that just never sat well with me. So I was like, that's an interesting aspect to the senior population. And then I think, given my constitution or demeanor, I just get along well with older people. So, and also my skill set from a training standpoint is very well suited for that population. I'm very good at dealing with corrective exercise and kind of slowing things down and getting people who have had a lifetime of doing things a certain way. I kind of have the patience and the skill set to kind of work with that population. It is a harder group to work with, but just based on my background from training, I'm kind of very well suited for it.
What kinds of people end up working with you? Like, who finds you or who's drawn to you, and why do you think?
There's two primary groups at this point. One is people that are actively in the aging process. So they are seeing their body physically decline, and they're kind of concerned about that, right? They're stumbling, they're starting to deal with like the fall risk is very serious at that
There's been a
point.
change, like a noticeable, yeah.
Yeah, exactly. Like we would describe it as gait speed, things like that. They're starting to notice that, and then they realize they need to start doing something physically to start managing the physical decline. As you well know, that's very often coupled with cognitive decline, but exercise is a great tool for mitigating that or slowing that down as well. The other population in the group that I work with is generally like their kids, because they're seeing their parents go through something, either physically declining or especially on the cognitive side, because that's a whole nother dynamic that, unless you've gone through it and you've seen it, it's very jarring to be like, see somebody's cognition go, because you're like, at a certain point, you're almost like, this is not, I don't even know this person. Which is a very strange thing to go through. So a lot of their kids, where they see their aging parents, and they're kind of asking themselves, what do I need to be doing now to mitigate the risk against that when I'm in my 60s, 70s, 80s?
So they're midlife, like 40s, like early 50s, or what?
Yeah, late 30s, 40s. They're, trying to, it's kind of like a come to Jesus moment where they're like, I think I need to make some changes in my life.
Okay, got it. And what types of exercises have you found have the best impact, we'll say, for the cognitive changes that you see?
There's like three primary components. I'll describe it as that. So strength training is a big one. Strength training, resistance training, weight training. Those are all the same thing. Cardiovascular training, aerobic, that would be the same. And then the third category is like balance. So they're all going to have different outcomes and different purposes. I think strength training and weight training is the most underutilized and has the biggest benefit, because with weight training, just by getting stronger, you're naturally going to have better balance. You're going to have better stability in your major joints. You're also going to be able to help fight muscle loss, which just happens with aging. You're going to help mitigate bone loss. So if a fall does happen, you're going to be much more protected against it through the resistance training. And I see one of the biggest things I see is people over prioritizing standing on unstable surfaces and working on balance training, but never focusing on like lifting heavy weight. And obviously it needs to be done safely, but I think more people should be prioritizing weight training and resistance training than the balance training. It has its place, but I think it's, for the aging population, it's overutilized, and the resistance training is underutilized.
Why is that? Is it just, it's not as fun to have to lift heavy weights?
I think people are scared.
Okay.
Like there's a lot of fear around lifting weights. Like people who've had a knee at some point, there's an association between doing squats and knee pain and knee discomfort. There's an association of doing deadlifts and lower backs. So a lot of it is kind of managing people's fears and expectations and putting them in safe positions, and then giving them the confidence to be able to do those exercises safely and repeatedly, where they are confident that they can pick something up off the ground. They are confident that they can squat down and their knees aren't going to be hurting, because there are plenty of ways to teach these things and get people stronger in good positions. There's just a few tricks you need to do, and then you can give the people that repeated confidence, which keeps them moving much more. And as I'm sure you know, keeping people moving is incredibly important.
Yeah, thank you. That's really helpful. So when you have somebody, many people have back issues, especially lower back issues, chronic degenerative changes and disc thinning and herniated discs, things like that. Can these individuals, or how do you work with them who are concerned about making things worse? How does that go?
It's a very reasonable concern. It's going to depend on the individual, and they've probably had a surgeon recently. They've probably had physical therapy recently. So I'll always coordinate with them to understand what they were doing, what worked well, what their tendencies are, just so I have a good starting point on that. But for backs, there's a lot you can do. The main thing is you don't want to end up usually driving them into too much extension, which is like arching of the lower back. And ironically, a lot of people actually need more flexion, which is like rounding of the lower back. But a lot of people are very concerned about rounding because they think rounding the back is not a safe position. So again, it's overcoming a lot of these preconceived notions, and they'll spend too much time arched, and just very passively, we need to spend a little bit more time creating, basically I describe it as creating space in that lower back, which can actually relieve some of the tension on those discs. But I first try to kind of build the confidence and then get people loading those safe positions to get them stronger. And another thing that happens a lot is they'll start doing back exercises and they'll tell me, they're like, hey, I feel my lower back. And it's great that they communicate that to me, but a lot of times I'm like, it's a lower back exercise. I'm like, I want you to feel your lower back. There's a
I
lot of
see.
muscles there. There's a lot of muscles there. I want you to feel it.
Okay. Well, that's good that you feel you can calm them down, because I could imagine they're going to tweak it, or
Mm-hmm.
in those moments. Can you recommend, say, anybody who's 70 that's generally not in any kind of acute medical crisis or needing surgery immediately? Are there certain exercises, like top 3, that you would recommend strengthening certain muscle regions, or does it just depend on the person?
It'll depend on the person, but I'll still give 3 general recommendations. One of them is to just walk as much as you feel safe and is comfortable. There's not like an amount that you need to do to make it beneficial. Like, if anyone's listening to this, the one thing I hope you can get away from this is understand that anything more than you're doing now is beneficial. Like, you don't need to go to the gym for an hour. You don't need to go to the gym and strength train for 30 minutes. Like, going for an extra 5-minute walk per day is beneficial. So I always try to get people walking. That's my first thing. And they say, how much? I go, just more than you're doing now. And once you start doing that and that becomes more of a habit, I'll build a little more structure around how much they're walking. And we'll kind of look at numbers. We'll look at step count, but I just get people comfortable walking more than they are now. The second exercise would be squatting, because that's a proxy for sitting and standing. So can you get up from your chair? Can you go to the bathroom? Just trying to keep things very functional as far as these major muscle groups in the hips and the legs. So any sort of squatting movement, and that can be a body weight squat. I get people in the gym, I try to get them to leg press. It's a great way to load their body in a meaningful way that's very safe. It's a very contained movement. And the third one, I'll give you 2, just because these are basic movement patterns. Any sort of pressing and pulling. So like a push-up movement, not that I would necessarily have people doing push-ups, but I just want you to understand what a pushing movement is. Like a push-up is a pressing movement or a pushing movement, and then any sort of pulling movement, just so we're working the shoulder joint in 2 different directions. A lot of people have shoulder issues, so there's some things you can do, some things you can't, but those are like 3 major patterns that I try to get everyone to do.
Okay. And would you give that same advice to anyone who's, say, like 40?
But yeah, I still use those patterns. It's just the intensity in which you can load them. 40-year-olds, I'm going to drive a little bit more rotation with them as well. But for older folks, we start with the very basics.
Okay. Got it. Thank you. And you mentioned, any amount is good, basically. And, we hear recommendations such as like 150 minutes a week of, I think that's like aerobic exercise, but do you give any specifications on these different types of exercises?
I do at some point, yeah. But at first, it's just getting them moving. because it's all behavior change, right? So first, if somebody has never consistently exercised, I'll lay out kind of what an ideal week might look like, and understand for somebody in their 70s, I might ramp somebody up to this over 6 months, 9 months, just getting them comfortable getting to this point. But yeah, you want to be doing 150 minutes of cardiovascular per week. And that can be, for some people, that's walking. Some people might need to be walking on a treadmill so you can get the incline a little bit. But that it's just having your heart rate consistently elevated for an extended period of time. As I said before, my main goal is just getting people to move more in the beginning. But I will lay out sort of like what an ideal week might look like for somebody who has been doing this for a while. And this is something that I would probably, I ramp people up to this over a few months. This is not something I would throw at people right away, because if you've spent a lifetime not necessarily exercising, trying to add 5 days of activities per week is,
Yeah.
it's an unrealistic expectation, and you might be setting people up for failure. So that's why I start with just walk more each day this week than you normally do. That's where I start with people. But an ideal week would probably look like something like 150 minutes of cardiovascular training per week. That is, for most people in that age range, that's going to be walking. It might be walking uphill, it might be walking briskly, but you just want your heart rate to be slightly elevated for an extended period of time. That 150 minutes, I would prefer to split that up into as many days as possible. So probably 30 minutes, 5 days a week, as opposed to going out for a 2.5 hour walk 1 day a week, because that leaves 6 days where you might not be doing anything. So it's more just about getting moving more on a consistent basis. Strength training, ideally I'd have them doing strength training for at least 2 days per week for at least 40 minutes. And then if you're setting aside an hour to work out, 40 minutes of strength training, and then I would do the remaining 20 minutes for balance training. And that can be, depending on where people are, that can be on unstable surfaces. That might just be doing inline standing. There's a variety of tools and techniques you can use, but that's how I would lay out an ideal week. But if you think about that, that's 2.5, 3.5, 4.5 hours a week of activity. So for people that are coming from kind of a baseline of nothing, I'm probably going to be introducing maybe 45 minutes to an hour per week. I'd be like, let's do one strength training session, or one session where we'll do a little bit of strength training, a little bit of cardio, a little bit of balance. And then I want you to walk a little bit more on your own every day. And that's how I'd introduce somebody to this and slowly ramp them up over time.
Great. I love that. Can you tell us a success story you've had with somebody maybe who they noticed they got stronger and their thinking got a little better?
So this is a great example, just because she's doing very well, but also like to reiterate the point of it doesn't need to be a lot to make a big difference. So this woman, she's actually remote. She lives up in Sedona. So it's all virtual like this. She had a series of falls 2 years ago, hip fracture, and as you know, and she's in her 80s. So that's kind of the reference point. So falls for people in their 80s can be quite devastating, very risky. She rehabbed, but she just didn't have the motivation. And around that time, she also did a cognitive assessment, which indicated some level of cognitive decline. Spoke with the neurologist up there, possibly Alzheimer's on the early stages of it. So that's where she was. And she just didn't have the motivation because she was in a walker. She never wanted to use a walker. She was a dean at ASU for up until she was like 81. So she was super active, and then, mentally active as well, but things just kind of went downhill quickly. And we just started doing we do 2 sessions a week. I still work with her, and it's mostly chair yoga that we do. Like, we do marching in the chair. We do a lot of rotational stuff, but the main thing that I worked with her on was her mindset. And I know you did a webinar recently about one of the most important things is like having a belief, like being positive in that things can change, things can improve. And she was very fragile in her mindset. She was scared to walk. She was scared to go out and do social activities because it required a lot of her spouse to be with her all the time and like constantly be behind her with her walker. But now, a year later, she has had a fall since then, but like her confidence was enough that she was not scared of walking. She now walks for the most part without a walker, without a cane. She does about 2,000 steps a day, and she's very active in the community again. And her instances of like having memory lapses are much lower now because she is much more engaged in her day-to-day life, and she's not sort of being reclusive and hiding out from the life that she used to have.
Wow. So many things that are all interconnected. So, wow.
Exactly.
For doing that, helping her like that. And I'm curious about that other fall she had. Like, sounds like she bounced back pretty well.
Yeah, so her son is on the East Coast and she was out visiting him. So she flew by herself out there. She was with a walker and she kind of slipped up on a curb. So not a hard fall, but still a fall at 83 is not ever easy. And it could
Yeah.
have been one of those things where she would, I feel like, potentially kind of relapse into the fragile mindset, but
Yeah.
she immediately jumped back to, she's like, I'm not hurt. I'm not going to stop walking. She was already like mentally charging forward. So she's like, I'm not going to let this stop me. So she
Wow.
was in a very good place mentally for that to happen at that time.
Mentally and physically. And yeah,
Right.
she had the extra padding with muscle, I'm
Right.
sure. Yeah, it's understandable when you're facing your mortality when you're in your 80s
Yes.
and you don't want your life to end and, lose everything because of a stupid fall.
Mhm.
So it's easy to make your whole world get small because of that fear. Well, I'm so glad that she connected with you and she's still working with you,
Mhm.
which she could have just done, 6 months and moved on. But seems like from what I understand, and you can speak to this, it's hard work just to maintain muscle
For
bulk.
sure.
Like over, I don't know, I think I tell people like over 45 even, or you
Mhm.
can correct me because I might be saying the wrong things to people for years, but like the likelihood of bulking up your muscles when you're older as an older woman, that's so unlikely. Even with Olympic lifting, you're not going to get ripped and like look, weird or
Mhm.
something. So can you talk about that?
Yeah, like, I'm not gonna say it's impossible, like, plenty of things are possible,
Yeah,
but,
no,
like, what is the normal expectation? Yes, like, when bone mineral density starts going down in your 30s, muscle mass starts to go down 30s, 40s for sure. So, yeah, for the most part, if you're like, unless you're working out like 4 or 5 days a week, but if you're working out 1 or 2 days a week, which is reasonable for the expectations of a lot of people, you're going to be working to maintain your muscle mass. That's going to be your primary goal. Be like, I'm trying to not lose my muscle mass and I'm trying to maintain my strength. You can definitely still build, and that's always the goal when I'm working with people. But for a lot of them, they're like, I just want to not lose my muscle mass, which is a great goal.
Like, how do you measure? What are your metrics when you're working with older adults? How do you know what makes people happier? How do you know they know it's working? Is it just, oh, look at my body looks more toned or I have more energy or
It's a mix of objective and subjective. Like, a lot of people just, they know, like, I feel better, I feel
yeah.
stronger. But a lot of people like would do DEXA scans. A lot of people will come in already at a certain age where they're like, I got a DEXA, I know I have low bone mineral density. So that's something we'll check and we'll monitor over time. And then you can also see muscle mass on there as well as like, total body fat. But at that age, more what we're looking at is like, are you maintaining muscle mass, maybe putting on a little bit of muscle mass, and what's happening with your bone? Because ideally, we're keeping bone mineral density the same, if not trying to improve a little bit um, over long periods of time. But that's the goal. So from the objective side, we're using DEXAs. We track strength numbers as well, and people
Mhm.
like to see their numbers go up, and they know, like, oh, I did 200 pounds on the leg press. I started with 45. It's like, yeah,
Yeah.
you can really progress quickly. So they understand that, but most of it's by feel. They're like,
Mhm.
I feel more confident. I feel better in my body. I feel like I can do more things and I can do what I want to in my life. And that's the important thing.
Yeah. Wow. That's so wonderful. There's been a lot of research studies, interventions looking at non medication approaches to slowing down the risk of, say, Alzheimer's disease. And some of these are using what they call multimodal approaches with not just exercise, but other things altogether.
Mm-hmm.
And there was this big one that just released their positive findings called the US Pointer study.
Yes.
Now, I'd love to hear your thoughts on that and how an individual, someone, over 55 can incorporate those into their life.
I don't want to speak to where people are mentally, but I think once I describe this, a lot of people go, that kind of makes sense. So there were 2,000 people in this study. They followed them for 2 years. It was split between a structured group and an unstructured group. And the interventions, the multimodal interventions, were exercise, nutrition, brain training, like cognitive training, ongoing health monitoring, and then there was like a community aspect of it as well. So on the structured side, they worked people up to, on the exercise, doing 4 30-minute cardio sessions per week, did 2 20-minute strength training sessions per week, and then 2 15-minute mobility and balance training sessions per week. For the nutrition, they were focusing on getting people to change their diet more towards basically a Mediterranean diet, which is very nutrient dense. A lot of people can get really caught up in these different diets, and I'm sure you've seen on the internet, there's lots of debates over that. But the thing that most of them have in common is that they're all nutrient dense. They're all minimally processed diets generally. On the brain training side, they did group-led facilitations of kind of goal setting with health coaches and facilitators. They also used an app for basically brain training, just adding demand for the brain, because the brain is essentially like a muscle. And this is like my analogy as a trainer. Whereas like if you don't use your bicep, your body will just go, okay, we don't need this thing that much. So it's going to atrophy. The brain is similar in that you need to supply a certain demand to it to make it work, to make it keep functioning the way you want it to. And then the ongoing health monitoring. It was keeping an eye on, certain metrics that you'd want to be looking at anyway as you're aging, basic metabolic factors that your primary is going to be probably looking at. So the main thing in this is that it's behavior change. And there were so many touch points on the structured side of this intervention where there were weekly meetings, you're doing the group exercise classes twice a week, you're getting guidance on the nutrition. So there's so many touch points. It was a very high touch intervention. But after 2 years, they did, I think, brain scans. And I believe the structured group, their scans looked about 2 years younger than the unstructured group. And it wasn't even a control group. It was just, they were told basically to do the same things, but they only had 3 team meetings over 2 years. So just many less touch points.
That's exciting that both benefited.
Yeah, exactly.
With the high touch. And then it was, just to round out about the studies, they brought people into this trial who were, I think, I can't remember the age, like 55 to 75 or something. And they were at higher, they didn't yet have significant cognitive decline, but they were at higher risk of eventually developing Alzheimer's disease and related, because of different medical issues like high blood pressure, high cholesterol, diabetes, obesity, or they had a sedentary lifestyle, things like that. So, but it wasn't the picture perfect health people who were in this trial, right? It was people that really needed a lot more help to get, say, healthy. So that's sort of what most of our US population is at that age. How are you bringing any of those findings into your work?
Just to kind of piggyback on what you were saying, I felt like, yes, it was very representative of the US population, which is great. And then the other thing I wanted to say before touching on that is, I think people can get a little bit overwhelmed when they're like, oh, I need to do all of these things for brain health, but I need to do these things for heart health, and I need to do this for diabetes. The nice thing about this finding is, like, I think what a lot of us knew already and the consensus we're coming to, like, a lot of these things are related, where if you do a lot of things that are good for heart health, they're also going to be good for brain health. Like, the main exception out of this study was the cognitive training, the brain training, right? You wouldn't do that for your heart, but most of the other things, exercising, changing your diet, building community, all very important for heart health as it is for brain health. So to your question about, do I incorporate this? Yeah, now I kind of in a more meaningful way that the study results have come out, but I've always tried to be like that facilitator for people who want to improve their nutrition. Like, I'm a nutritionist, but I always refer out to dietitians because they're just better and they have a much better education on that. But I'll like stay in the loop, so me and the dietitian are working simultaneously to kind of drive them towards the results that the client wants. And yeah, I've now have like a bunch of printouts of kind of the ideal exercise protocol from this study, just so people can know, be like, all right, I'm working with you 1 day a week. What should I be doing on my own? So now I have like a great structure for them to be, so they can check things off on their own. They can bring in their worksheets, so I can see it. There's just a little more structure around what people are doing, and they're a little more confident knowing that they can read the study. Alzheimer's did a great job with the marketing materials around that. So it's very understandable for everyone.
Great. I love that. And I think that high touch, high support is so crucial with everything as we age. And I'm incorporating that into my work too, and just realizing more and more that people, for, whatever reasons, they need to constantly be nudged to do things. It seems like as we get older, there's different, everyone's lives are different. like a care partner so stressed and busy that maybe they can't stay on top of all these things, and they really appreciate like me, like kind of almost nagging them sometimes.
Hmm.
But the people that like it, I keep, help keep them, my team helps keep them accountable for these goals that they themselves set and want to achieve. But to create that community surrounding that and knowing that someone's going to be asking you tomorrow if you did these things is so valuable. So that's exciting, and I look forward to seeing more of your work with those learnings.
I think the community aspect is really important. So like I recently started offering small group classes just for that, where it needs to be a few like-minded people, basically in the same situation, because I've seen this before doing group classes in the past where when the members are holding each other accountable, I'm like, that's when I know I've built a really good environment, a really good community. And I know they're going to be doing that with each other outside of the class. So the community aspect, the feeling accountable to someone else, not just your coach, is so important. And I think community it's undervalued because it's not like, it's hard to quantify. It's hard to get data on like, well, how strong is your community? It's not the same as an A1C. It's not the same as blood pressure, but
Yeah.
I think it's arguably more important.
Definitely. Love that. And I used to, as a clinician and as a physician, I used to say, I don't want to, be someone's like parent or feel like they like need me to push them. But I guess I've learned like a little bit of pushing is really helpful in these situations. And it's not like they're completely relying on me. It's not a bad thing. And then one other point I just wanted to mention from what you said, that cognitive stimulation is actually something I personally have stopped bringing up consistently with older adults, because if you are doing all of these other things, you are stimulating yourself cognitively. Like you are already engaging in all these things, trying new things, pushing yourself. Like you don't need to intentionally go play Sudoku or something else. Like all of these things are frankly better, more fun probably for you. So, so I've taken that off the list explicitly, hoping that people will find it in these ways. So I'd love to shift to your work, your men's work and facilitating these groups that you do, and wondering if you could share. We know there's this men more frequently as they age, they tend not to, their worlds do get their groups, their relationships, they have less people they're talking to. Certainly in our current society compared to, 20, 50 years ago, there's not these groups of men coming together consistently and supporting each other. So I'm wondering if you could talk about, with your work, how do men approach exercise and health and brain health differently than women do? And what are the kind of strengths versus blind spots that you see?
I think men are very willing to exercise. And a lot of times, as far as like self-improvement is concerned, not always, but it often ends there. Like I will improve my physical body and that is enough. So obviously it's brain health, mental health, how we kind of carry ourselves in the world, how we relate to other people in the world. That takes a lot of work, as you were mentioning. If you're out interacting with people, it's an incredible amount of cognitive load, right? You don't necessarily need to do Sudoku. But I do find that men will use the gym as like an avenue for self-improvement, but oftentimes I just see it end there and not necessarily ending up with stronger relationships or a stronger community, maybe other than like the guys in your gym. The goal of me starting this group, and like I coax people in with it being in a gym. So we start the session with a group workout. So like I kind of draw people in that way. But even the way I structure the session, I try to encourage people to move beyond it just being a workout. Like we should be working on how we relate to each other, how we show up for each other. I think women in this world do a disproportionate amount of the emotional work in the home, in the workplace. And then like men aren't there for each other to kind of be these emotional like containers for each other and just the support systems. So women have to take that on as well. So the group is to kind of create men that are more well-rounded, able to do some of this emotional work in the world and just show up in a more meaningful way and actually, take action in the world in a meaningful way, not just getting stronger.
That's great. How long has your group been going on?
2 months.
Okay. Oh, it's new.
It's very new.
That's
Yeah.
exciting. That's so wonderful. I love that. I can't wait to hear how that goes. I didn't realize you were a nutritionist also.
Mm-hmm.
That's exciting.
It was, so this is probably a worthy conversation. I don't think a lot of people understand the difference between a nutritionist and a dietitian,
Yeah.
and it's enormous. So I became a nutritionist just because as a personal trainer, you end up having a lot of conversations around food. And the scope of what you can talk about as a trainer is kind of limited. It's a little bit expanded as a nutritionist, but like there's no, especially in Arizona, there's no legal protections around the term nutritionist. So basically anyone could just hang a shingle and say they're a nutritionist, or pop on Instagram and say they're a nutritionist and start charging people. And then if they mess you up, there's like, there's no legal protections really. Dietitians, it's like a 6-year degree. It's a 1,000-hour internship.
Wow.
It's a very extensive certification. And then it's a state licensure as well. So like you can become a nutritionist over a weekend if you want to, versus 6 years of formal training and then the internship and then the state licensure. So the difference between dietitian and nutritionist is enormous. That being said, there are still great nutritionists. And there are still bad dietitians.
Yeah.
Start with a registered dietitian.
Okay.
RD. Yep.
Okay.
Start with an
And
RD.
then sometimes those are covered visits. Some of those are covered by
Yep.
insurance.
Exactly.
Yeah. Great. Great. So, how do you personally maintain your resilience, brain health, and balance in life?
I try to take my own advice and like kind of diversify. I try to do things that are not just work related, but are like meaningful for me. A few examples of that are starting this men's group where it's like, I want to do something that's not driving revenue. It's not creating profit. It's just something that's like meaningful for me,
Mhm.
that I do in the community. Another thing is cycling. Like I obviously like, I like working out. People are like, oh, cycling is just another form of working out. But the reason I got into cycling is because like it's just such a fun feeling going downhill. I was describing this to someone recently where I'm like, I just haven't had the feeling of going wee in such a long time, where I'm like, that's a feeling you get on the bike and it's just a fun, like childish feeling. So it's one of those things where it's like, it doesn't have to be serious all the time. I like riding a bike, not because it's great fitness, but because it makes me feel like a kid again. So I try to do things that put a smile on my face. And then I'm lucky enough to be in a position like working this kind of job where it's very rewarding. Like most of my day is incredible. Like I don't feel like I'm doing like stupid work, or I don't have
Mm.
busy work that a lot of people have to do. So I'm very lucky in that like most of my day is very purpose driven. So I have no lack of like feeling of purpose and meaning, which is, I realize what a privileged position that is to be.
Yeah. Wow. I love that for you. What do you want for yourself in like 5 years from now? What's your vision?
I really want to have like expanded this into something more formal, kind of like, we've discussed this of doing something more formally around like the implementation of the US pointer study findings, where it's
Mhm.
like, can we actually create something that's like standardized and able to be implemented at a much wider scale? Because I see these results and I do get concerned. I'm like, these results might just kind of sit there and people are just going to flounder with the implementation, because it is hard to coordinate amongst group fitness and
Mhm.
nutrition and medical professionals and facilitators and health coaches. Like it's a lot of moving parts, and I'm worried that it's not going to get implemented properly or at all. So I really
Mm.
want to build the company that is helping to facilitate that and teach people other people how to facilitate that as well. Um, and also by that point, on a personal note, I'd love to have property in Vermont with animals and like a garden. That's what I want to work towards.
Oh yeah, Vermont. Nice.
A lot of land, very green.
Yeah. I love that.
Hmm.
Great. Well, I'm optimistic that's all going to happen for you, Parker.
As am I. I'm annoyingly optimistic.
Can you share what are your parting words of wisdom for all of us listeners who want to be resilient agers?
There's two things. One of them I already touched on, which is like walking more. It's it's free, it's accessible. Grab a friend, go for a walk. It's one of the best things you can do. You'll feel better and
Mhm.
it's great for your health. The second one is more, this is touching back on men. Um, and also just the idea of like resilience. I think there is this big push within the longevity space, which is, I think, well intentioned, but it's missing a big piece, which is the acknowledgement of your own mortality. I think a lot of things around longevity right now almost seem like they're trying to pretend death doesn't exist and
Mm.
they're going to live to 150. And I'm like, that seems misguided and a little bit antithetical to living life.
Mm.
So a big part is like acknowledging your own mortality and like really sitting with that and meditating on that and understanding it. And once you like understand the weight of that, I think you can live in the moment much more fully.
Beautiful. So Parker, let us know, where can people find you? What do you have going on?
I am on Instagram, which is probably the best place to find me. And I want to make sure I have my handle correct, which I think is Parker.Condit. Yes, it is. So it's just Parker.Condit. I just started working with a marketing person. So they're going to help me post more consistently. So I'll actually be more present on there instead of being very sporadic. And that'll be the best place to connect and find out more about what my company's doing, collaborations, random musings around the aging space.
Great. And your company again is called InTouch Health and Performance?
That's right.
Okay, wonderful. Well, thank you again for your time. We'll put all this information in the show notes. Thank you, listeners. If you're checking us out on the Brain Love Community YouTube channel, please like and subscribe and comment. And if you're listening on the podcast platforms, please rate and review us. It really helps get the word out. I'm Dr. Dani Cabral of Brain Love. You can find us at mybrainlove.com. Please send me a message about anything if I can be helpful and our team can be helpful as you're navigating aging and resilient aging. All right. Thanks again, Parker.
Thanks so much for having me. It's a fun conversation.